Okay, so this is one of my favorite types of cases to show. This is a gentleman that I have had in my general practice for quite a long time. Worn dentition, so look at the anterior teeth. Um, Problem is that there's no room to restore. He's really constricted with his bite that you'll see in a minute here. He's missing a lower premolar, but the canine position isn't terrible. And then on his left, class 1 occlusion. Premolars are a little collapsed there, but look at his anteriors are retroclined here and chipping, but not a lot of wear on the posterior. I mean, you see this all the time, every day with your patients. And he's concerned about the chipping and the wear. So, I mean, what do you do here? I mean, you can add to the facials of the uppers, but on the lowers, I mean, what are you going to do here? So we got to make some room. And Invisalign is the perfect thing to do here. It's going to take a little bit longer, but look at that. I mean, you're going to add to the incisal ledge. He's going to break it back off again, and he's going to say, geez, doc, you only did that a couple years ago, and that broke off again. I mean, you can add some veneers to the facial. I mean, that's what I did. But as you know, it's not a lasting solution. So we're going to make some space. This is basically a restorative case that we're setting up to be able to restore this guy's occlusion. Okay, now I have some room. I can reset his protrusive. I've got room to reestablish the canine guidance there on his left. And look on the right, that's beautiful. I can use composites. I can use veneers or crowns, whatever you want to use. But I mean, to me, this is something that I can, build up at least temporarily in composite. I can retouch these lowers, but I can add to the maxillaries on the lingual, and this is perfect for me. This sets you up for some really nice restorative work in your practice. As a restorative dentist, I mean, I wish I had this 5 years ago. I mean, I can count so many patients that are in very similar situations to this gentleman. And all I had was my restorative stuff to use, and I tried all the things that you try. And, it really was a losing battle because of the occlusion. And so now, to set yourself up for a nice case that's going to be predictable, that's going to be financially a great thing for you and a long-lasting thing for the patient. So next time you see this, I hope Invisalign pops into your head because it's the perfect type of case for this.